I would say about 30% of our patient population is female. And one of the most concerning things about hair loss is there's so many unknowns. So I like to provide this visual as a way of really understanding the different influences that can lead to hair loss and different ways that you can address each one to hopefully reverse that process and generate healthier hair. So there's about 7 different influences. There's certainly more, but these are broad categories that I like to point out that may influence the state of hair. One is hormonal. Another is a nutritional influence. There can certainly be an inflammatory component that can influence hair health. Apoptosis or cell death is taking place throughout our body, and that can certainly impact the state of your hair. There's a structural component. There's a microbial component as well, which is a potential bacterial component. And of course, there's a genetic component. Now, a lot of the things that are non-surgical can help address the various influences except for genetics. Genetics, the only way to really address that inevitability is a surgical approach. And there's a separate video, and I'll describe the rationale behind surgery, the people who are good candidates and not so great candidates for that. But surgery is something that can have a permanent benefit, whereas each of these other approaches and strategies, they can certainly lead to an improvement, but they do require maintenance. And so let's go over them one by one. If you look at this grid, you can see the influences in the left-hand column and the levels 1, 2, and 3. What that essentially means, these are different sort of strengths of approach to address each influence. As you move to the right to level 4, that's probably the strongest and potentially most effective way to combat these negative influences. So let's start with hormones. When you have a negative hormonal influence on hair, that's something that can shorten the duration of the growth phase. By making the hair growth phase shorter and shorter, the hair loses volume and you lose overall scalp coverage. So there's a very simple and well-known topical medication called minoxidil, or rogaine, that can be used by both men and women. And the idea behind minoxidil is it prolongs the duration of the anagen phase. It prolongs the duration of the growth phase, and that can lead to overall hair volume, because hair is a tapered structure. It's thinner at the tip than at the base, so as it comes in, it can become a bit thicker. A stronger approach can be combining minoxidil with other topical medications. There is spironolactone is something that's been shown to have a benefit to women's hair when used topically. 17-alpha estradiol is something that's been used in clinical trials and shown to strengthen women's hair. It can increase the overall number of hairs and the caliber of hairs. Melatonin, interestingly enough, that's something that can help women's hair in the crown. And even when minoxidils blend in with retinol, a form of vitamin A, that can help deliver it to where the stem cells reside to amplify its effect. The next level up, I'd say level 3, there are oral medications, oral finasteride and oral spironolactone. Those are both medications that can have a more positive effect potentially on scalp and have an earlier effect, but there can be systemic side effects from using these pills. Certainly if you're on either one of them, you don't want to get pregnant, because both of them are teratogens, which can lead to feminization of a male embryo. So you don't want to take those if you're pregnant or if you're planning on being pregnant. The last and probably potentially most effective approach to addressing the hormonal influence are injections of a drug called dutasteride. Now, this is something that's been used in Spain for quite a while, and the evidence is such that in both men and women, when undergoing a series of dutasteride injections, it can help reverse the process of hair loss, increase the overall caliber of hair, and even increase the number of hairs per bundle atop the scalp. I'll get into more detail about dutasteride treatments in men and women in a different video. But let's look at the next influence, nutritional. Certainly when people take biotin, that can again speed up the rate of hair growth, and with hair being a tapered structure, that can increase the caliber of hair. However, there's a lot of other influences that can be addressed nutritionally. Iron is certainly an important cofactor in hair growth. Oftentimes in female hair, that can have a considerable impact if people have a low ferritin level. Now, ferritin is not your iron level, but it's a reflection of your body's ability to take the iron that you ingest and use it. There was a study that looked at over 430 women who all had hair thinning. They did blood draws, they looked at a whole bunch of lab values, and the one thing they all had in common was their ferritin level was less than 70. You want to make sure that your ferritin level is above 70, and the way to do that, the way to raise it up, is by taking an iron supplement. Now, iron supplements can be constipating, but there's one type of iron in particular called bisglycinate chelate that's the most effective in terms of absorption. It's the least constipating and the best at raising ferritin levels. Vitamin C helps with iron absorption. Zinc is an important cofactor. Vitamin D is also important. There's many different elements, and I'll get into more detail in a separate video that looks at the specific hair growth supplement that we offer. Inflammation is another influence. There's various medicated shampoos, even ketoconazole shampoo. One of the benefits of that is it can have a mild anti-inflammatory effect. A step up is a clobetasol shampoo. Clobetasol is a steroid essentially, and using that in the shampoo form can be a bit more effective in minimizing inflammation. And ultimately, PRP, the primary benefit of platelet-rich plasma is its prolonged anti-inflammatory effect. It's used quite often in orthopedics for the same reason when people have inflammation in joints, in the scalp. Inflammation can lead to hair thinning when there's inflammatory cells around the stem cell containing part of the hair follicle. By addressing that, it can prolong the growth phase and ultimately lead to more hair growth, and that's one of the things that PRP can do. PRP also, if you get to the next influence, can hold back the process of apoptosis. It can hold back the process of cell death. And again, by holding back that process, hair can become longer, thicker, fuller. Cell death's taking place all over our body all the time. Our skin turns over about every 28 days. Our bones are always breaking themselves down and reforming, and our hair is no different. It wants to be in the growth phase, but apoptosis or cell death causes it to stop, fall out, and have to come back in again. So by holding off the process of cell death, it allows the hair to come in more fully and provide more coverage. When PRP is coupled with a dutasteride treatment, that's one more thing that can prolong the duration of the growth phase and really address that influence of cell death. So that's probably the most effective strategy in that category. Structurally, there's a whole bunch of volumizing shampoos. Essentially what volumizing shampoos can help do is take the cuticles of your hair follicle and raise them up a bit to give your hair more structure, more volume. It's purely aesthetics. It's not a biological influence in terms of hair biology. But if you look at your hair under an electron microscope, it looks almost like a little reptile. Each of those scales are cuticles, so a volumizing shampoo can help raise those up and improve the overall volume of your hair. The next category, the microbial or bacterial, is really not fleshed out, but we're starting to learn a little bit more about it. If you think about the microbiome of the gut, a few years ago, nobody talked about that, but now it's something that people realize can have a tremendous influence on your overall health. And as I said before, genetics, unfortunately, there's nothing that we can do about our genetic makeup. However, when people have thinning here and they have healthy hair here, this hair can be placed there and lead to an overall improvement. That's how you can address your genetic predisposition with a healthy, effective, and permanent surgical approach. I hope this is helpful. Again, I'll get into more detail in different videos, but this is the holistic approach we have to female patients. Thank you.